Good morning, everyone. We have several still joining the call. We are right at the hour, but I'm going to wait just a minute or two because that waiting room is still very active. So get settled and we'll get started in just a minute or two. Good morning, everybody. We will wait just one more minute, and then we're going to go ahead and get started so we can respect your time. Good morning. We have several people saying good morning in the chat. Hello. Okay, well, good morning, everybody. We'd like to thank you for joining our presentation, our call today, Lead Your Team, Health Literacy for the Win. I am Heather Norman Bergdorf. I'm an associate professor here at the University of Kentucky in the Department of Dietetics and Human Nutrition. I will be co-presenting this training today, and I'm going to really quickly turn it over to our other co-presenter and allow her to introduce herself.
Hi, everybody. I'm Liz Edgell, and I'm the Director of Refugee and Immigrant Services for Family Health Centers. I'm coming to you from Louisville today. And I also supervise our community health workers. So I know there's a lot of community health workers on this, so I'm excited to be with you.
Perfect. So this session today is being hosted by Health Literacy Kentucky. That may be an organization that you've heard of before, or maybe that is brand new to you, but we are a statewide coalition, and our main goal is to have a healthier Kentucky through a more informed and empowered Kentucky. And so this means we are seeking to build communication skills between patients, clients, and their healthcare providers so that they feel better equipped to take care of their own health. So this means everything really from legislation to community education. This lesson and the content that you will see today was originally conceptualized several years ago as a deliverable from a grant. And that grant is long over, but we knew that what was created had a lot more life in it, and it was still a critical need for Kentucky. So over the past couple of years, Health Literacy Kentucky has worked to repurpose what you're going to see today. And with some support from UK Cooperative Extension, we've been able to rebrand and repackage this lesson into what you see, this actually really nice, fun visual presentation. So today's session is going to last approximately an hour. When we're through, you're going to be able to walk away with the resources to be able to actually give this presentation and this information within your community. We're going to also have some time for some questions, probe you a little bit to think about how you could use this material. So you may want to think about that as we go through the presentation today. And then we will also have a brief survey at the very end. Of course, we have to, but this is actually a requirement for those who are hoping to receive a CEU from this training today. So I have a few comments and housekeeping before we get started. I know we still have more people that are rolling in the waiting room. But first, just to let you know that we are recording today's session, and that will be available to you and sent out to every person that registered for this event so that you can, reference that if you want to, or even pass it on to someone else you think would benefit from it. Also, do not hesitate to use the chat feature to ask it's very active already, but to ask questions throughout, to make comments. And we have some folks who are watching that, monitoring that, and we'll do our best to address any relevant comments or questions as we go throughout today. Many of you have already done this. I love it, but we'd love to see who you are and where you're from. So I'm seeing a smattering of people from across the state. So we would love, I've seen Paducah and I've seen all the way to Pikeville. So if you would like, feel free to put that into the chat so we can really see the diversity, the geographic representation that we have across Kentucky today with our training. And then we also invite you to turn on your camera if you feel comfortable. We understand that may be a challenge if you have, limited internet connectivity or some challenges like that, but we would love to see you if you're interested in that. We also know lots of life things are happening, and you may want to keep your camera off. Okay, so I have a quick question for you all. Looking at the title slide here, there's a bunch of X's and O's in the background. And this was actually a conversation among our HLK team when we were putting this together of, well, people know what that means. And so I'm curious, I'm assuming we have some sports fans out there that kind of know what the X's and O's represent. But if you want to drop that in the chat really quick or think about it or be like, maybe I've seen that before, maybe I haven't. It's a game plan. Yes, football plays. I remember middle school basketball, we would draw up plays like this. So they represent a play that may be drawn up for teams to know how and what to do during a game or a specific situation. And we can think about our healthcare as a team sport, right? Working together and within our own healthcare team. And we ourselves, we can approach this presentation as the individual learning today. But if we think about if we're sharing this information with patients or clients, we want them to feel empowered to be able to make the right move or draw up the right play and ultimately lead their healthcare team. So that's where we're going today. Someone said hugs and kisses. Yes, that was another thought someone threw out, that the X's and O's, but these have a different meaning besides hugs and kisses. It's just funny. All right, so today's plan. We're going to walk through the presentation today in a train the trainer format. What we're going to do is we're going to provide the lesson for you to better understand concepts that are woven throughout. And then we're going to show you how to find and use these same resources so that you can use them after this session, so that you feel better equipped and trained to lead the session. We're going to have a few tips and suggestions. We're share how to get those resources. And we essentially want you to feel knowledgeable on this topic so that you can take this back and you feel more comfortable in your own community leading an educational session or a workshop on this same topic. So as a result of participating today, you're going to be able to define health literacy, determine strategies for making well-informed health decisions, be able to explain the importance of communicating effectively with your healthcare team, and walk away with some new tools that you can add to your toolbox or playbook. I know that's corny, but to go with the sports theme, right, that you could take away from this and use in the future. We also know that there is a diverse group of folks who are attending today. So we've got many community health workers, we have social workers on the call, we have several extension agents from both UK and Kentucky State University attending. And some of you may work within a clinical space and consider yourself a direct part of a healthcare team. Some of you may be embedded within the community, connecting individuals to services and resources. Our extension agents are there at the community level, providing evidence-based programming and information on a wide range of topics. But no matter really what your role is, the underlying goal for every single person on this call is improving the health and well-being of your community and your community members. So I'm hoping that even you can kind of see where you plug into this concept of a healthcare team and how you can empower a Kentuckian, right, to be informed and make the best choices for themselves. So as we talk through today's content and address the healthcare team, we don't want you to think that we're asking you to step outside the scope of your own profession or to provide clinical information or anything like that, right? We want to just challenge you to see yourself as that healthcare team that's supporting the well-being of an individual in the places and the spaces that they live, because they're different all across the state. So we hope by the time you leave here today, you could clearly define health literacy, talk about strategies for communicating if communication is a challenge or a barrier. We're going to talk specifically about medicine. We get lots of questions about medications and how to manage them and how confusing they are. And then the big thing that we want you to take away from this is really the 5 things that you can do that helps you personally be a better member of your own healthcare team, but also empowers potentially your future clients or patients who you share this information with. Some of this may be already known. You may already know some of the things we're going to talk about. Some of it may be brand new. We just simply ask that everyone joins the space today with open-mindedness and a willingness to learn from one another, because I have a feeling that the chat might be active and there's going to be some great information that's also shared there, as well as from Liz and myself. Okay, so first, let's introduce some of the members of the healthcare team. So there are a lot of people on a healthcare team. Think about who your own providers are. And they all really do want to help. So who is on your team? It's going to depend on the type of office setting that you have, whether it's a clinic that you visit or whether you are in the hospital. But basically, your healthcare team consists of the following people. So you have your doctor, right? And in some rural communities, you're going to have maybe a physician's assistant or a nurse practitioner who is going to be that primary care provider or the specialist that you're seeing. Nurses, they could be serving in the capacity as a nurse, or they could be serving in a variety of capacities and different roles using their experience and expertise as a nurse. Your dentist, very important. A dietitian, so a registered dietitian, that's going to be an individual who is connecting nutrition and food to health outcomes. I mentioned physician assistant, your pharmacist. Some communities may not have a doctor's office, but they might have a pharmacy instead. And that pharmacist is a valuable member of the healthcare team who can address and answer lots of questions. We have social workers. This is where we could link and talk about the role of community health workers or even extension agents making connections to necessary resources that support health and well-being. And then therapists, which is actually a really broad term. There's a variety of different types of therapists, whether that's a physical therapist, an occupational therapist, speech therapist, psychologist, right? Now, could you think of some others that may be missing? Who are some that you think potentially could be added kind of to this complex, comprehensive picture of what a healthcare team could look like? I'll feel free to drop that in a spouse, perfect example. So thinking about maybe an individual who attends appointments or makes appointments for you. Again, CHWs, of course, caregivers, whether that's the caregiver for a child or an older parent, or it could be you're caring for your spouse. Med techs, there's lots of different people that we could add to this list. Feel free to add more as you think of them. But the one that we have not mentioned so far is you, right? So after going through all of this, you really are kind of in the center. You are the central player in your healthcare team. So what is health literacy? How is it that you would define this kind of scary term, right? If you're not used to medical speak or jargon, how is it you would define health literacy to someone who maybe is, 5th to 8th grade reading level? I'd love to kind of see where you guys are landing and how you think this term should be defined. I'll give you just a second. We've got a couple that already have jumped into the chat, so feel free to take a look there. Ability to understand medical terminology, knowing where to find information. Any other thoughts? All right. So here's a definition that we like. So health literacy allows the public and personnel working in all health-related contexts to find, understand, evaluate, communicate, and use information. That requires a lot of skills. A wide variety of transferable skills are needed in order to accomplish each of those verbs, right, that are in that definition. We can almost not water it down, but simplify it to this. So it is our ability to read, understand, and act on health information. Acting on health information could even mean, a couple people have mentioned, filtering out or filtering through health information, right? There's a lot of noise out there with the internet and social media, but being able to filter through health information and determine what is evidence-based, what is not, what's credible, what is misinformed. And when we're asking people to read and understand something, immediately I'm hoping some of you thought of how important cultural implications are for this, right? Not everyone's going to be able to read and understand and act on the exact same type of health information, but understanding that they have access to or the ability to receive information that is culturally appropriate so that they can read, understand, and act. And this is something certainly that we can do better and move forward in the future, but we need to be thinking about this and talking about this when we define health literacy. Okay, so research has shown, this might be surprising for some, that understanding health information is a problem for almost everyone in the United States. And even if someone may consider themselves health literate, there may be specific circumstances or challenges that they've been in that they still don't feel entirely confident. So the National Assessment of Adult Literacy conducted by the Department of Education showed that literacy levels in the US have basically stayed the same since about 1993. I'm wondering if some on the call were even born at that point. But this survey was repeated in 2003 and added questions that were specific to determining health literacy levels. And the results show that only about 12% of adults are proficient in understanding health information. Now, remember, we just defined it as read, understand, and act, but here we're saying 12% of adults really are only at that level of being able to understand, okay? So you might be wondering, well, what are the levels? What are examples? What does that actually mean if we looked at that? Well, examples of tasks at each level, we have below basic, basic, intermediate, and proficient. Below basic would be circling the date on a doctor's appointment slip, like knowing when their appointment is going to be or what time their appointment is. Basic health literacy would be able to give 2 reasons a person with no symptoms should get tested for cancer based on a clearly written pamphlet or piece of information that they could read. Intermediate would be determining what time to take a prescription medication that they were given based on reading the label on a medication. So just knowing what time to take it, with food in the morning and at night, and being able to use that and understand that. And it's at the proficient level where we would actually see that an individual could maybe determine what their share of a health insurance cost would be if they had to use a table to be able to calculate that. Again, you can kind of see here, 12%. So that's about 1 in 10 adults have literacy levels that are considered proficient. Okay, so why does this matter? Why is it that we need to be concerned about health literacy levels? Because there can be serious health consequences for an individual who is unable to read, understand, and act on health information. You guys could have made this list probably. You could have populated it on your own, but these are just some examples where we've actually seen this in the literature. And we know that there are clear connections between those with lower health literacy. They have poor health knowledge. As a result, they're going to have poor health status. They're going to be resorting to hospital and emergency department room use because they may be uncertain or scared or unsure what's happening or how to act on information from a doctor. And then a condition worsens to the point where they need emergency care. And we also see that there's some connections, although the literature is a little mixed here, on health literacy and using preventative services, chronic health care. So if they have a chronic condition that they're having to manage regularly, and then tobacco use is another topic where low literacy levels may actually correspond with increased tobacco use. Now, I'm going to pass this over to Liz and let her kind of jump in and share a little bit more about what it looks like to deal with health literacy in real life.
All right, so health literacy, oh, you want to go to the next slide, Heather?
Sure.
Thanks.
Oh, there we go, strange words.
Okay, so dealing with health literacy might be strange words. We're going to talk about some of that. The skills that you need include talking with your healthcare team. Health literacy might include not knowing how to ask questions, so we'll talk about that. And then just paperwork. There's so much paperwork in our culture and in our healthcare system. So next slide. As far as finding health information, some of you already mentioned that in the chat. It is a skill that is really important. We need to find the information, we need to understand it. Communicating is a really big piece of this. So we all know our health and our bodies. Our healthcare providers only see us for a few moments at a time. So if we're not communicating with them, then a lot can go awry. Taking medications the right way, knowing what to do when you get home from an appointment. Heather asked, what's the definition of health literacy? And sometimes I describe it as all of the things that you have to do between doctor's visits, between healthcare visits, or between hospital stays, right? We are the main player on our healthcare team, so we have to make all kinds of decisions every day that could impact our health. And then using this information. So let's do an example of a real life example. Who has ever been sent to a big facility for an x-ray? I know I have with my kiddos, which is even scarier, right? So you're looking for the x-ray department. You might be looking for a sign like this, but what it might look like in the actual hospital setting is something like someone's name, some fancy donor, they get their name there, and then the radiology department. And radiology is not a word that most of us are throwing around. And that's probably not what the nurse practitioner or the doctor told us when they ordered. They probably said you're going to go get an x-ray. So just these simple things, they're small, but they're big. And when you're scared and nervous and you're trying to find your way through, the signage is really important. So this is one barrier from real life. Next slide. Medications, of course. So quick quiz, who reads those little stickers on your prescription bottles? Anyone? Sometimes I've even noticed that you can get the same, oh good, Hannah reads them. Sometimes you can get the same prescription every month and they put a different sticker on them. It's like they don't all fit, so they rotate or something. But we find a lot of people don't read them. The font's really small and they just don't. So understanding prescriptions is a huge area in healthcare, whether it's over the counters or those prescription bottles. So the next slide. It's really important to know that everyone has health literacy issues at some point. My friend Kristen Monroe-Layton and I teach about health literacy a lot together, and Kristen's always really good about explaining that it's a spectrum. And we can have low health literacy moments and we can have good health literacy days, right? But what happens is most of us, it's not about our education. I'm a nurse by training, and I promise I have low health literacy moments, especially when I don't feel well, or if it's about my children, for example, when we're worried, when we're concerned, we just don't absorb information as well. So we need to recognize, and sometimes because the word literacy is in there, people will get hung up on like reading skills and reading abilities, and that's part of it. Math skills can also be part of healthcare. But in general, we're not really talking about that school-based learning. We're talking about the whole system and being able to navigate and communicate in the system. So it's bigger than just reading. Oh, you're going to go back a little bit. Okay, so
I'm sorry, Liz. My computer is being very touchy, so
it's
I'm
a very
doing my best.
excited button. Okay, so there are some words like medical vocabulary is a big part of healthcare. This is one of the reasons I work with refugees and immigrants a lot, and this is one of the reasons that I always try to advocate that even if someone's English is very good, that they might still want an interpreter in a medical visit, because the words we use in healthcare are pretty unique. So some words are medical words and you expect them to be complicated, like hypertension is the fancy word for blood pressure, high blood pressure. Angina is a chest pain kind of condition. The stethoscope, like we don't use that word every day, but that's the thing they listen to when they're listening. They put in their ears when they're listening to your heart, your lungs. Cholecystectomy, that's a very fancy word. That means having your gallbladder removed. So some of these are just medical words. Other words may not look complicated, but they have a different connotation. They have a different meaning in the healthcare setting. So I think one that's really important to be careful with is negative. because in our daily lives, like negative Nelly or negative has a bad connotation, right? Things are bad when they're negative. In healthcare, we're usually using that word when we've done an x-ray or procedure or a biopsy where we're looking for something bad. So if it's negative, that means it's not there. So that's actually good news. So, negative for cancer, for example, that's very good news. And so we just have to be really careful that we give people context if we're the healthcare providers. So we say this is good news, and we explain it really well. As a patient, if you're not sure if this good news or bad news, go on and ask that question. Is this good news? Is this bad news? Stool is a fancy, we're not talking about like a three-legged stool, something you sit on or stand on. They're talking about bowel movements or poop. When a doctor says, oh, go back to your regular diet after the procedure, they probably are not saying that you need to lose weight. Like in our culture and social media, we're talking about diet as in losing weight. And then what they really mean is your regular diet, what you're normally eating. In the hospital setting, there are liquid diets and soft diets and different kinds of food that you're allowed to have. And then fast or fasting. Fast has nothing to do with speed, really, in the healthcare setting. They're talking about not eating, like before you have a colonoscopy, that you can't eat that night before, you have to fast. So words are not always what they seem. So what do you do? Like, what do you do if you don't understand? We want to ask questions, right? And there are different ways to do that. Sometimes you don't even know what questions to ask. So on this slide, you'll see this is a campaign. It's called Ask Me 3, and you can look it up and you can print out sheets that say these questions and you can fill them in when you go to the provider. I think this is a great tool for when you don't know where to start. You could ask these questions of anyone in the healthcare setting, your dentist, your pharmacist, your nurse practitioner. And the question is really, what is my main problem? What do I need to do about it? And why is it important? So if you ask these three questions, you're going to get a lot of information about what you need to do. And it can work for a chronic condition like diabetes. If you get a new diagnosis and there's lots of things you need to do, these questions will apply. It would also apply for just an infection like strep throat. What's my main problem? You have strep throat. What do you need to do about it? What do I need to do about it? You need to take your antibiotics, the full course, all 7 days, even if you feel better on day 3. Why is that important? Because if you stop on day 3, the germs might come back. They might come back stronger. We need to make sure we kill them all. So like anyone, that's an example of a short-term use of this. But these are 3 great questions to ask if you don't know what else to ask. You can also build your question list, and we have resources that go with this presentation. There's a website where you can actually put in your condition or your procedure that you're learning about, and they can generate questions for you. So it's really good to prepare in advance and have your questions when you go in. And one thing you can do is sort of, if you're uncomfortable, it's just at the beginning of your visit, say, hey, is it okay if I ask questions? That way you're just kind of establishing that you have questions and you're finding out, you're reminding the provider that you have questions and they should talk to you in a simple way. Nobody's really insulted by plain language, but sometimes we need to remind the providers that this is new to us. This isn't something we talk about all day long every day. So think about the questions you want to ask. Working with your healthcare team is really, really important. We've already mentioned this a few times, but they are not mind readers. They do not know what's in your head if you do not express it. So tips, you want to be prepared. You want to know your medicines and your allergies and your health conditions. There is a reason. I know it's annoying to us as a patient. Every time you go to a new provider, you're answering the same questions, but it's because it's so important for them to know those things. It's not too young to start this. I have a middle schooler, and I've started letting her fill out the paper for her own visits so that she's learning, because honestly, her memory's better than mine. Like, I will forget the medicine. I forgot melatonin. She takes melatonin. So after our last visit, I decided she's not too young for this. She can answer herself and get in this habit. Writing down questions in advance is huge. I think it is, we've suggested before that you have a healthcare notebook and you write down the questions in your healthcare notebook whenever they come to you, because they come to you when you're at the grocery store or in the shower late at night. They don't come to you when you're sitting in that cold exam room. So if you have your questions written down, it'll make things go better. And you want to be ready. You want to explain why you're there. They're going to ask you basic questions: what you tried, what helps, what makes it worse. It's your body. They're asking those questions because they're putting together a puzzle and you have the pieces. Sharing your question list at the beginning of a visit is also a great tip. You want to tell your story. No detail is too small, right? There are a lot of things in healthcare that we may not think are associated, but a provider might be able to put different pieces together and realize this is a syndrome, or those things actually go together pretty frequently. So don't be afraid to tell your story. Details also matter about your medications. Even if it's over the counter, we have a big assumption that everything over the counter is safe. And it can be, right? It's not prescribed. Over the counter means the medicines that you can just go and buy. But if your providers do not know everything that you are taking, it can have bad outcomes. Ginkgo, for example, ginkgo biloba, some people take that to improve their memory, but there are certain heart medications that are known contraindications. You should not take them together. And unfortunately, people have found that out the hard way. So you just want to be really clear, have a good list of all the medicines you're taking, and be honest, right? So if you didn't take the medicine that they prescribed, and then you find yourself back there for a 3-month follow-up, you've really got to be honest and say, I didn't take it. Because what the provider is going to do is think that you did the thing, right? They're going to think you took the medicine. They're going to change the dose. They're going to say, oh, you're not getting this outcomes we wanted. You must need a higher dose. And that's a real life example. That has happened to people. And then you've got a new pill you're not going to take. It's still not going to fix the problem. But if you're honest with the provider from the get-go and you say, I really don't like pills, then they can work with you. And they might say, okay, well, let's try some exercise. Let's try diet changes. There are certain things that they might be able to try with you, but they can't if you don't tell them the full story. Same thing with alcohol. If you go in for surgery and you drink alcohol every day, you need to tell them, because if you go through withdrawals in the hospital, it's going to be a scary thing, right? There are bad implications to us kind of guarding things and thinking we're protecting ourselves. The next slide. As far as remembering what to do after your visit, this is half the battle, right? I joked about my own memory. I do find that there are too many things. We're getting too much information and little sound bites and snippets everywhere. What you really want to do in these important medical visits is capture as much as possible about what was said. I love the strategy of bringing someone with you. I'm not, like, for refugees and immigrants, I'm not talking about someone to interpret for you. The providers need to give you a trained interpreter. I had an aunt going through breast cancer treatment, and I told her and my uncle, I will go to your visits. I will go to all your oncology visits. And my uncle said, it's only down the street. We can drive there. And I said, it's not about getting there, right? It's about having an extra set of ears to listen. And I was the note taker. And afterwards, the three of us would be in the elevator. I mean, we just left the exam room. We're in the elevator, and my aunt would ask a question. My uncle would have heard it one way. She heard it the other way. And I got to say, oh, let me look at my notes, right? So having that extra person and that other strategy of writing down things can be invaluable. Also, you could ask to record. Sometimes you're at an appointment by yourself. Many smartphones have this, you could do a recording. It's always good to ask the provider, is it okay to record this? There's other stories of family members, like where the patient doesn't want to ask questions, but the adult children really want to know what's going on with mom. So they're able to record it, and then they can all hear the information together. And usually the providers like that. They like a family who's interested. They like having that team approach. You also want to know what to do. Who can you call if you get a question at home? Is there a triage, like a nursing line you can call? How do you get a message to the provider? Is there a My Chart or some electronic version of communication with the provider? You just want to know where you can go with your questions, and knowing whom to call, right? So now we're going to go into this area of taking medication safely, and this is huge. This is why we dedicate a section of the presentation to medications, because as far as health literacy, this is where a lot of mistakes are made. So these pictures, can anyone say what these all have in common? They're kind of different shapes and different colors, but what do they have in common? They're over the counter, most of those, yeah. These are all different NSAIDs, right? These are actually all different versions of ibuprofen, right? These are the same medication. Different shapes, different packaging, different colors, different brand names, but they are all the same medication. So just an example of how complicated the system is. And with some medications, if you overdose, if you take too many of them, not knowing they're in the multi-symptom over-the-counter medicine as well as the pain medicine that you're taking, for example, you can really get into some trouble. So the number of over-the-counter medicines is overwhelming. Who can you ask? How do you know what over-the-counter cough medicine or cold medicine to try? Has anyone gone to a pharmacy or grocery store pharmacy aisle lately and looked at how many cough and cold options there are? So asking your nurse, you can call your primary care provider and ask the nurse line, what should I take for this? And they might give you advice. That's one option a lot of people don't think about. The pharmacist. They are such a key member of our healthcare team that we usually forget about. And at a retail pharmacy, I'm not going to lie, they're busy, especially lately. They seem to all be understaffed everywhere. But if you are willing to wait, they usually have a window and you can ask advice and they will tell you. And most of my friends who are pharmacists say they do not want to be on the phone with insurance companies all day. They like to have patient interaction. Like they would like to walk out to that aisle with you and talk about your symptoms and make sure you take the right ones so that you're not over medicating yourself. Okay, so it's really important to go in and be careful about all of those over the counters. Make sure you're taking things safely and not be afraid to ask for advice about which ones to take. Another example, what these all say, these are all different medications. What do they have in common? Does anyone know what the common ingredient here is? Acetaminophen, do you guys see that in a few of these? Acetaminophen is the generic name for Tylenol. And this is one where you do have to be careful. It is in a lot of those cough and cold and sinus medicines. It's there for your regular headaches and pain. It's there for fever. It might be in your prescription pain medications, like hydrocodone or Lortab. They might have a Tylenol component. And you just have to be careful because too much Tylenol can be really, really hard on your liver. It can be really quite dangerous. Overdoses on Tylenol are not pretty. So we just need to be careful. This is another example of how even over-the-counter things can be dangerous if we're not careful, we're not paying attention. So as far as medicines in general, it's good to keep a good list. We at Family Health Centers where I work, we tell people just put your pill bottles in a bag and bring them in because we actually learn a lot that way. When we look at people's prescription bottles, we realize sometimes that a specialist is providing a high blood pressure medication, and so is the primary care provider. We learn that by looking at the bottle that they're seeing a different provider we might not have known they were seeing. We learn that one bottle's very full, they're not taking that one. One's empty, it's empty too quickly, they might be taking the wrong amount. There's a lot we can learn from those pill bottles. But if you don't want to carry all of those around, at least make sure you have a really good list of what you're taking and include the melatonin and include the ginkgo and those vitamins and herbs and over the counters. Being careful with liquid medications. I think it's really amazing how many liquid medications do not come with a dosing cup, or maybe the dosing cup is really hard to read. Some of them don't even have black on there. They're clear on clear. So you just need to be very careful. Imagine putting a tablespoon of salt in your recipe instead of a teaspoon, right? That's a very big difference. So a spoon is not a spoon is not a spoon, especially with kiddos. Most of our kiddos have to take liquid medicines, and we've really got to learn and ask and be careful and use the syringes or the dosing cups. And many nurses, many pharmacists would be glad to take a Sharpie and mark the line for you, make it easier to read, make sure you understand. For all of your medicines. And we have some handouts available about this too. You want to know the name of your medicine. You want to know how to take it. You actually want to know why you take it, right? This one's for my blood pressure. This one's for my headaches. If it says to take it every 6 hours, does that mean you get up in the middle of the night to take it? Or does that mean every 6 hours while you're awake? These are important questions to know and ask your providers. And studies show that most people make mistakes with this. Even the best of us with the best intentions might misunderstand this. So this is really just really important to ask and learn. Other medicine things you need to know how long to keep taking it, right? So some of them are, if you have diabetes, if you have high blood pressure, this is a chronic illness, meaning it's not going away right away. This is lifelong. You may need to take this medication forever. In that strep throat example I gave, you don't need to take it forever. You need to take it until that one prescription, that one round of antibiotics is finished. So those are important questions. Knowing how to get refills is something that you all might work with with your clients or your family members. Can they get set up for automatic refills? Do they need to call every time? It's important to know to look for how many refills are remaining, because if it says 0, it's going to take a little longer because the pharmacy is going to have to contact the medical provider. So we don't want to wait and try to refill when the bottle's empty. Right. So these are skills and these are things that can be confusing and they can vary. You can go to CVS and they do it one way. You go to your local pharmacy, they do it a different way. So really learning how to get those refills and make sure you understand the process. It's all part of health literacy. So we've talked a lot in this brief section about health literacy and lots of different components on it. So go on to the next slide. So just in summary, we've talked about writing down your questions. We've talked about really talking with your healthcare team, meaning being honest, asking your questions. We've talked about making a list of your medications and understanding what they're for. And now we want to also encourage you to share what you've learned today. Use this with your friends, your family. Heather's going to talk to you a little bit more about how you might envision yourself doing this as part of your work. And then also just a kind reminder to be patient with yourself as you build health literacy. There's a lot of steps in here. I feel like it would be a full-time job. If any of you are caregivers, you know this can be a full-time job. Managing someone's health literacy, managing their healthcare processes. There's a lot packed in here. Emily Beauregard and I have talked for years about health literacy and the challenge, because we don't want patients, we don't want all of us community members to feel like everything is weighing on us, that we have to navigate this horribly complex system. That's why organizations like Kentucky Voices for Health and Health Literacy Kentucky are also advocating for system change. Let's be honest, there are many things packed into this that could be improved if the system were simplified. Insurance could be its own conversation, right? So we know that we've got to look at it from both angles. We want you to do your part, and we also want the system to get easier. So we want us all to play together for this win.
Perfect. Thank you, Liz. I'm going to apologize for all the technical glitches. What I'm thinking happened is that some of the slides are timed and I wasn't aware. So it's clicking through and I'm having to drive the slides for you. So thank you for your patience, and thank you to everyone who's attending for your patience. So we're going to take the last few minutes. We're about 15 minutes till the hour. I'm going to ask you to kind of step out of the role as the participant and now think about the lesson we just shared with you as a tool in your own toolbox as the educator. I know some of you probably already provide education and programs on this topic. Maybe this is a brand new topic for you, but I want to think about how your own job duties and responsibilities, how does this new resource fit into your work? How could you use this? How do you see this as being a new tool for you to use? So today we've shared the PowerPoint with you. So the slides that we presented today, the bulk of them are actually the presentation that you will have access to use in your own programs. The slide deck also has all of the speaking notes included. So again, if you don't feel super comfortable just talking off the cuff about some of these topics, there are speaker notes throughout the entire presentation that you could use. We also, Liz referenced the question list in the presentation. Here you can see a screenshot of that resource on the slide. There are also several other lesson materials that are available to you, and they are listed here. So you will have a facilitator's guide. This is essentially that leader guide that will walk you through what the lesson would look like, all of kind of the little details that need to be in place if you were to offer this lesson or program in your community. There's suggestions on group size and different organizations you could reach out to as partners. There's information about how the outline of the lesson should go. Also, there are activity suggestions that are included within the facilitator guide. So really, it's just a package document you could pull down, read, and then hopefully you feel equipped to plan, schedule, and then implement this lesson. As I mentioned, the PowerPoint with the detailed script. You have an evaluation tool where you could look at some intermediate outcomes as far as knowledge or intentions for behavior change as a result of participating that you could then share with your agency organization or for you to use in an impact statement or share a success story. There's a flyer provided, the question list, like I mentioned, a screenshot here. Today, we didn't use any of these, but these are also available to you. There are 3 role play scenarios that really are kind of a script where you could get participants involved, where you have a unique situation, and then you have some discussion questions that are incorporated to help people see and actually practice putting health literacy actions into place. We also have 3 videos that are linked. So these are things that you could incorporate into the PowerPoint or save at the end of the PowerPoint if you have time. There's a word scramble activity, so some words that are related to health literacy. This could be a great time filler if you're waiting for your class or your participants to gather and for class to start. It could be used at the end. It could be sent home as an activity or tool with participants. And then there's also some logos that would help you with marketing. So say you wanted to make your own flyer or you wanted to share this within a newsletter that you have, you could use those logos for consistent branding and marketing across all of them. So these pieces can be used in a variety of ways, depending on your class size, your space, if you have technology available. If maybe you don't have a way to play a video with audio, that's totally fine, right? Maybe you aren't able to use PowerPoint. So instead, maybe you could talk through the question list and then have some role-playing activities that are done. And if you have a short presentation, maybe you want to prioritize the slide deck. Maybe you've got to fill 2 hours, right? So then you could really incorporate videos and the presentation and then have role playing at the end. So really we wanted all the pieces to be flexible and how you could use them and kind of piece them together to meet your specific needs. Now, everyone is wondering, how do I get to these? How do I find these, right? There are a couple different ways you can get to them. So it says external to UK, but anyone could use this as the access point to get to these resources. They are housed and located on the Health Literacy Kentucky website. If you scan this QR code, say with a phone or a tablet right now, it would take you directly to that website. If you just Google Health Literacy Kentucky, it's going to be the first thing that pops up. I'm going to ask you to scroll down. You're going to click Tools for Teaching and then Community Members. And then it will take you to a Google Drive folder where all the materials are there and you can just easily download to your computer. Now, if you go there and you download them to your computer, you can just save those in a space on your personal or on your work computer, a personal computer that's easy to access, and you don't have to use this access point every time. So just keep that in mind. If you go there and get them, then you're going to have them and you have them downloaded. Here are a couple screenshots. So if you Google Health Literacy Kentucky, it'll bring you to this page. If you simply scroll down, you'll see tools and resources for community members, one click, and you're there. You'll see it. All right. For those who are with UK Extension specifically, I also know that we have some extension agents that have joined us from KSU. These resources are found on the internal website and are password protected, and you'll just have to use your link blue. So like any other programming materials that we have available for all the different topics, you would access them the exact same way. So essentially going to the master resource list, health, safety, and wellness, and you would scroll down under general health. For anybody on this call, I'll put my email out there. It's heather.norman@uky.edu. Feel free to send me an email. Or, if you're looking for them right now and can't find them, put that in the chat. And one of us will certainly get with you so that you can find them if you are having difficulty. And especially extension agents as well. Just send me a message and I will be sure that we get these materials into your hands. Okay, so we have a few minutes left. And I really do want to kind of open up the chat. I see that it's kind of active and you guys are already making some comments here, but I want you to think how you could use this lesson in your work. This is a question I want to challenge you with right now. And then, maybe you don't have an answer right now, but maybe one you can kind of dwell on and continue to think on throughout today, and maybe something will come to you. But we want to welcome you to share in the chat because I think it could be inspirational for others who are also joining if they can kind of see how different people are planning to use these resources. I'll give you a couple minutes to respond, but I have a couple suggestions or ideas. Maybe these resources are a great conversation starter for you and an organization or an agency in your community that you've wanted to connect with, you've wanted to establish a partnership with, or, host or offer an educational event, but you never really knew how to start the conversation. Maybe this could be it, right? Coming to them with these materials and saying, hey, would you be interested in partnering with me to host a lesson on this topic at the SNAP or WIC office or at this local school. Really, so many settings within your community, even if they're not clinical, would still benefit from a lesson like this. Another idea might be using these resources for one-on-one conversations. If you have someone sitting down with you and just being open and honest and sharing concerns or challenges about navigating their healthcare, maybe you can turn to these, pull these up, and talk through them one-on-one with someone, especially providing them the questions list or any of the other handouts and information that may be available. It looks like that we have a few responses in the chat. So local senior centers will definitely an upcoming talk topic. Monthly with diabetes support groups. So if you help support or facilitate support groups on a variety of health topics, right? It doesn't have to be diabetes, but it could be substance use recovery. It could be a number of different types of coalitions and support groups. Senior centers, parent night, I think that's a great one. A collaborative program between 4-H and Family Consumer Sciences and Extension would be wonderful. Yeah, there's some really great suggestions. So I encourage you, if you're able, to open the chat and kind of scroll through, and you might be inspired or see something that kind of prompts you, be like, oh, I think I could use it that way. That would be beneficial for me as well. Yes, feel free to keep dropping in your ideas. So we only have a couple slides left. I know some of you are still typing how you see yourself using this, but this is where I want to give you this space in the last 5 minutes here to see if we can address any questions that were asked throughout the presentation, or give you some time now to drop a question into the chat that you would like for us to do our best to address. And I see that very important consideration of different languages. So translating the presentation points into Spanish or other languages for our non-English speakers, that is seen and heard for sure. And we understand that that is a need. So any other closing comments or questions? Liz, is there anything else you would like to share kind of during this time?
Well, I see in some of the comments, somebody mentioned like, I want to do this for my church, or I want to set this up. And just to harken back, you gave some of the history, but when we had the original grant, that was exactly what we did. We tried to train trainers so that they could go out and set up this presentation in churches and schools. And I think you guys, many of you are well suited to do that. And also to say that one-on-one piece, I think in this iteration, so since Extension revamped it a little bit, and there's the handouts and other ways, that just having one-on-one conversation is also an option. So I think it's really it's exciting to get to see more people interested in that. It's exciting that so many people registered, and we will share the recording so you can share it with colleagues who couldn't make it today. I also was going through the chat, and there was a point earlier during the presentation about a love-hate relationship with my chart or the electronic records, where you can see the results maybe before your provider has called you. And yeah, I think there's certainly a part of healthcare where we will always go in with a little bit of paranoia, with a little bit of fear that the worst case scenario is there. And if you are not a health professional and you just Google what a lab result means, it can be terrifying. I get those calls from my friends when they have done that. And that's okay. It's perfectly normal, but I do think that's a hard part. We look for transparency in our healthcare system, and we look for patients to have access. And on the flip side, it might mean that they get access and don't understand the context. So that's just something to be aware of and reassure your clients and community as you work with them. I don't think I have anything else to say. I'm so happy that our chat was so active and this was such a participatory group. And we do definitely want you to do the evaluation. Do you want to go on to the next
Yeah,
slide?
I'll plug that on the next slide here to make it simple for folks. Here's a QR code. Again, if you have a smartphone or a tablet handy, if you just scan that, it'll take you directly to this very brief evaluation. There's also a tiny URL. So it's tinyurl.com/HLK evaluation. I'll reiterate that this is a requirement for those who are seeking CEU credits for this hour training. And rather than waiting, just knock it out now, right? Just go ahead and get it done, and then you don't have to worry about it. You don't have to look for that email and find the link, because we will be following up with all those who registered, sharing both the recording for today's presentation, the slides, as well as the link for completing the evaluation. So the link, yes, has been placed in the chat. That was requested. As people are kind of doing the evaluation right now, hopefully typing that into your browser, one thing that stood out to me, Liz, and this is just a final comment that I have, and it goes back to a comment that actually someone made about building trust between the educator and the patient or client, and even the healthcare provider. But you did a great job, Liz, of using personal examples. And I think even if you share that this is a struggle for everybody and you're using your own personal examples as you go throughout. So it's like you mentioned with your children, like anytime my children are sick, I feel like I pay double attention to how much I'm dosing or what the doctor said. But if you can just add in those little personal details or stories throughout, that's really going to help you build trust and connection. Talking about something that might seem really stiff or distance from someone, that is just one final suggestion that I have as far as like a tip or strategy when using these resources. Okay, last call. Here we go. There's your QR code. The link to the evaluation is in the chat. Any final comments or questions? This brings us to the end of our presentation. I want to thank each of you for taking an hour out of your day and being open-minded and willing to learn, and also then take these resources and use them within your community. We'll stay on for just a minute, but with that, thank you, and we hope you have a wonderful rest of your day.
Thank you, everybody.